As we speak, negotiations are ongoing between the House and the Senate on a compromise version of the Prescription Drug User Fee Act. The Senate version contains my amendment, and the House version does not. So we're fighting as hard as we can to make sure this amendment is included into the final bill. Last month, I stood here on the Senate floor and shared stories that I heard in communities across West Virginia about why this amendment is so urgently needed. Prescription drug abuse is responsible for about 75% of the drug-related deaths in the United States and 90% in my home state of West Virginia. According to the White House Office of National Drug Control Policy, prescription drug abuse is the fastest growing drug problem in the United States, and it's claiming the lives of thousands of Americans every year. But no statistic can illustrate the scope of this problem like hearing the pleas of children who are begging their leaders to do something to get drugs out of their communities. Children like those I met in Wyoming County, West Virginia last October, where more than 120 people have died from drug overdoses in the past 7 years, including 41 last year and 12 already this year. Mr. President, since that proud moment when the Senate unanimously passed my hydrocodone rescheduling amendment, it has come under fire, as you can imagine, from groups who seem to think that trying to limit the number of hydrocodone pills making their way into our communities and oftentimes into the wrong hands is a bad idea because it affects their bottom lines. Now, I recognize that this amendment does not fit into the business model of selling as many pills as possible. I understand that. But with that being said, I believe we have a responsibility to this great nation and especially to the youth of America. This will affect us for generations to come, sir. To win this war on prescription drugs needs to happen now. And it is one of the most abused substances. Hydrocodone is one of the most abused substances we have and the most addictive. I don't think I've talked to a person who does not recognize that each and every state is experiencing these horrible problems with this prescription drug abuse. And the facts will bear this out. According to a report issued by the Centers for Disease Control in November, the death toll from overdoses of prescription painkillers has more than tripled in the past decade. The finding shows that more than 40 people die every day from overdoses involving narcotic pain relievers like hydrocodone, methadone, oxycodone, and oxymorphone. These prescriptions, painkillers, are responsible for more deaths than heroin and cocaine combined. Yet still we are hearing from some folks who just don't believe that rescheduling hydrocodone is a good idea. And I have said to these groups, let's work together on a compromise that can address your legitimate concerns. If anyone has a concern with this amendment, just come to me, and we'll sit down with you and try to work through it in the most reasonable manner. We've already offered a number of compromises to different groups in an effort to get this bill passed and signed into law. I want to clarify some of these concerns. We've heard from some with concerns that making hydrocodone a Schedule II drug would mean that patients with legitimate need for these medications would face increased hurdles to obtaining them, and that those patients would have to visit the doctor more often. To them, I would say the following. Look at what the DEA did in 2007 to reduce burdens facing patients when it comes to refills. They finalized a new rule allowing doctors to provide individual patients with a 90-day supply of any Schedule II medication by issuing 3 separate prescriptions, 1 for an immediate supply and 2 additional prescriptions that cannot be filled until a certain specified date. If they receive a 90-day supply, patients would only need to visit their doctors 4 times per year. And if they have a chronic ailment, I would think that those patients would want that type of evaluation anyway. That makes all the sense in the world to me, and I know to a lot of Americans.